Good day everyone. We are Group 2 from BSN 1Y3M10B and now we are here to demonstrate
bed bath, positioning, shampooing and oral hygiene,
back massage and transferring. Now, let's proceed to our demonstration.
Good morning, I am Nurse Pia.
And I'm Nurse Don.
Today we're gonna do positioning, back massage, and also transferring from bed to bed, bed to wheelchair to wheelchair, and repeat that.
So first, yun yung and then what is our age? 19. So over 30,000. Let me check the
Before procedures, do hand washing because it helps us to prevent the spread of infectious diseases. A number of infectious diseases can be spread from one person to another by contaminated hands. These diseases include gastrointestinal infections such as salmonellosis and respiratory infections. Low Fowler's position, like supine position, is when a patient's head is included at a 15-30-degree angle. This position can be used post-procedure to reduce lower back pain, administer drugs, and prevent aspiration during tube feeding. Low Fowler's position is considered the best position for patients to rest. Semi-Fowler's position, a supine position in which an individual lies on their back on a bed, with the head of the bed elevated between 30-45 degrees, and the legs of the patient can be either straight or bent at the knees. It is ideal for feeding, lung expansion, and decreasing cardiac or respiratory distress. High Fowler position is a supine position in which an individual lies on their back on a bed with the head of the bed elevated between 60-90 degrees and the legs of the patient can be either straight or bent at the knees. It's used when the patient is defecating, eating, swallowing, taking x-rays, or to help with breathing. Supported supine position. The individual is lying on their back with their face and abdomen facing upwards. During a procedure, the back of their head typically rests on a pad or pillow and their neck is in a neutral position as if in a sleeping position. Mostly used in examinations of the head and neck, abdomen and extremities. Prone position is often used for spine and neck surgeries, neurosurgery, colorectal surgeries, vascular surgeries, and tendon repairs. The prone position produces an increase in functional residual capacity and alterations in the distribution of both ventilation and perfusion throughout the lungs. Side, lying position can help cut down on sleep apnea. It can also nix neck and back pain since your spine stays aligned. Make it better. Place a soft pillow or folded blanket or towel between your knees to ease pressure on your hips. Sims's position or semi-prone position is when the patient assumes a posture halfway between the lateral and the prone positions. The lower arm is positioned behind the client and the upper arm is flexed at the shoulder and the elbow. It promotes the synchronous movement of chest and abdominal respiratory muscles. Now before you start, you should start hand washing. Every procedure requires hand washing first. Step 1. Position and lock the wheelchair close to the bed. Step 2. Place the gait belt around the patient. Step 3. Position yourself in front of their feet. Step 4. Remove the gait belt and make sure the patient is comfortable. Step 4. Do it vice versa, and always remember to position yourself in front of their feet to prevent slippering. Step 1. Tell the patient on what procedures you will do, and if the patient is uncomfortable, change the massaging technique, and also ask the patient if they prefer oil or powder. In our case, he chose powder. Step 2. Place the patient in a prone position and lift up his shirt. Step 3. Rub the powder first before you start massaging in order to spread and warm up the powder. First massage technique. Effleurage. It is a long, light stroke that warms up the body. Petrissage is an effective massage technique in which deep pressure is applied to tissue and underlying muscle. Tapotement. It is a rapid and repeated striking of the body as a technique in massage. Step 4. After doing all of those steps, you may now reposition the patient from prone position to supine position.